Today, the nation unveils Nigeria's health sector renewal compact and investment initiative. It's also the event to mark the World Universal Health Coverage Day.
We cannot afford to...
Attending the event, organized by the Ministry of Health and Social Welfare, are state governors, traditional leaders, civil society organizations, and development partners. A long list of partners, including the traditional institution in Nigeria, hailed the initiative and pledged their support.
Friends, colleagues, this is a time for Nigeria to take center stage to address the issues of maternal mortality, the high rates of stunting, to ensure that every family has access to good quality care.
It's no exaggeration to say that today could be a turning point for Nigeria and indeed for Africa. The scale of your ambition is a model for other countries, and if implemented, it will send a powerful message throughout our continent that universal health coverage is possible.
We will give our total commitment 100% so that Nigeria will be a healthy country.
For those who have a major role to play in ensuring the health sector renewal compact is a success, this is a historic moment.
We expect, and at least we have heard, at least $3 billion in pooled and non-pooled financing in the period 2024 to 2026, which is a huge milestone to be channeled towards improving our primary healthcare system and achieving results for Nigerians.
Our mandate to collaborate closely with the Federal Ministry of Health and ensure that the provisions of this compact are translated into practical and measurable actions.
Federal Republic of Nigeria to address that.
President Tinubu says the occasion highlights this administration's stance on quality health for Nigerians.
Delivering improved quality health. The outcome is an underpinning factor in my promise of renewed hope. That hope is ignited here today, and with your support, health is back on the front burner. Recognizing the importance of primary health care as the cornerstone of a resilient, integrated healthcare system, my administration is embarking on massive effort from 2024 to refurb physical infrastructure, equipment, and retraining of frontline health workers in collaboration with all the 36 states.
It's a historic day that highlights the points behind the universal health coverage, that everyone should have access to quality health services without financial difficulties. And after all is said and done here, what is expected is that the benefits of this partnership will reach every Nigerian across the country. From the State House, Lanre Lasisi, Channels Television News.
Okay, welcome back. Yes, those are some of the issues and more that we'll focus on here this morning. And as you've seen there, we've got Professor Ali Pate, the Coordinating Minister of Health and Social Welfare. Good morning, Prof, and thank you for coming on today.
Good morning, and thanks for having me.
Yes, indeed, a significant day yesterday. And you know, when we hear them say quality health to reach all Nigerians, and immediately I see systems all in place. I see emergency ambulance. I can call someone, then they're driving, pick one up, get to the hospital. So almost utopian in my mindset. Maybe you should bring me back to earth. What should we expect? What is this about, basically?
I think what you see, as you said, is the vision.
Okay.
That vision has been laid out, and I think the president laid it out, and the underlying direction that, in fact, he wants to go to take this country as part of his renewed hope agenda In fact, it's Nigeria where what you have seen is manifest. And yesterday, what we saw was the culmination of the consensus at the national level that the president led, where we have the state governments partnering with the federal government to invest in those services to actualize this vision, whereby primary healthcare, basic healthcare is available to Nigerians. And our development partners coming along to say, look, we've bought into this vision and will partner with the government and the whole breadth of Nigerian society, whether it's the traditional leaders, religious leaders, or civil society, or private sector, or philanthropists. Almost a national consensus that is built around this vision that the president has explicated. Now we move forward to the execution of that, which is to make the physical infrastructure available, the equipment to be available, training of the health workers to start with the guidelines that we are now revamping, and to track that process, the execution, so that we'll have a clear path that we are making progress in actualizing that vision. That is what has been set for Nigerians yesterday.
Okay, I see in your statement there, you talk about the strategic blueprints being to save lives, reduce both physical and financial pain, and produce health for all Nigerians. You also plan to reform and implement the national health system as provided for in the National Health Act. We know that we have some lovely policies in this country. Implementation is a huge challenge. Now you also seem to have identified that here. So the part that the governors were also present, how do you plan, where do you want to start with this?
So first of all, for 8 years, on getting to 9 years, we've had the National Health Act passed in 2014, which provided for the national health system, comprising the Federal Ministry of Health and the state ministries of health and other actors coming together. That national health system hadn't come together until yesterday, when this president pushed forward, got a compact between federal government, states, and development partners coming along. That is a major step in terms of implementation of that vision of the Federal Republic of Nigeria coming along to invest in the health of the population. Secondly, the federal government increased its own allocation for health, including at the front ends. In 2014, you will see as the appropriation is concluded, that's the direction. The expectation is that states will also match that, will also reciprocate, increase their own allocation, and we will track the increases, the releases, and the pace of execution. Thirdly, human resources are the lifeblood of the health system. So the plans to retrain 120,000 frontline health workers is real. They are all in the states. They are all employed by the state governments. We will retool them, train them with the skills that is necessary to interface with our population, to give care to pregnant women, children, those who are ill in our primary health care centers, but also to refer them to secondary facilities and teaching hospitals when need arises. Those are practical things that Nigerians would experience and will lead to better production of health, will save their lives, will reduce pain, both physically and also the financial pain, because we'll be expanding the Vulnerable Groups Fund through the National Health Insurance Authority, as you heard Mr. President say, so that it targets those who are most vulnerable, and that's on the financial pain.
That insurance part will still come to that, because that is a huge component for all of this. So I'm also shed a little more light, if you will, on this. So is it that you have a plan of action? Are there action points wherein you can say, okay, look, this is what the federal government wants to achieve and the country should achieve. On the part of the federal government, we have A, B, C, or D. On the part of the states, you have this. Have you identified those targets? Is it in primary healthcare? Will they cut across board? And then we know states don't earn the same. They budget differently. So are they supposed to budget the same for health sector, or according to their capacity, clearly?
I think all of us recognize that health is so fundamental, and states need to move up in terms of the allocation. We're far below where we should be. As you recall, many years ago, the Abuja commitment was formed here. We haven't met it. The government is moving up. Some states have increased, and some states have increased the allocation but have not released over the years what they have even budgeted. So the political prioritization implies that the budget is increased, but also the releases are increased and more timely to the institutions in the respective states and to use those resources well. So there's the issue of getting the spending, the quality of it, better health for the money that is being spent, in addition to more money to being spent. We have a very concrete plan and targets. In fact, we have signed a compact. The President has a compact with his team that specifies what we will deliver. And that's key to our own job security as well, to help deliver on this vision that he has laid out. And so with that, we expect states to also, let's say, complement the federal government in that direction. At the end of the day, we will improve the health of Nigerians if we, as the Nigerian state, build consensus that this is important. We need to invest, we need to get it done. And you saw that yesterday with the compact. President, governors, development partners, civil society, all of us deciding that investing in health is in our best collective interest. And that's what we are going to do.
Well, so I'm looking at everything that you've said, and it looks like it's targeted at people who are going to be sick in future. Not for people who are sick today or people who need medical attention. I mean, if you're pregnant, you're not exactly sick. But if any of those people were to be watching you, if any of those people were to be listening to what it is that you explained happened yesterday and how that affects their current situation, what would you be telling them?
So, all Nigerians are clients of the health sector. Those who are sick today, we are attending to them, and through our teaching hospitals, through the primary healthcare system, I think there are some services that have been delivered. There are some that are sick, but do not yet know that they are sick. Identifying them, screening them, that's something that we're also working on to improve the availability so that folks will know whether they have non-communicable disease that haven't yet manifested, so they can be arrested. But the generality of Nigerians who are presently healthy, how do you keep them to be healthy? And if you look at the blueprint that we have, is to produce health, meaning to exercise, to eat well, and to avoid the behaviors that put their lives at risk. They are also an important stakeholder group so that we don't get them to get sick. For those who are sick today, there are things happening. Recently, we invested and launched the human papillomavirus vaccine, for instance. That's a preventative vaccine that prevents future cervical cancer. But there are screenings of women that are available. We are revamping the infrastructure. In our teaching hospital today, there are services being provided. Now, is it adequate? I think there is room for improvement. That's why as we go forward as part of this president's direction to renew the hope of Nigerians, we're saying that we will do more. And with the federal government and states working together and our development partners, yesterday they announced almost $3 billion over the next 3 years in terms of parallel pooled and non-pooled but aligned investment to support this direction that Nigeria is going. And that's very helpful. But that's not going to be enough by itself. It needs to be complemented by all parts of our government in terms of this direction for it to be realized. The federal government alone will not, by its own actions or resources alone, be enough to translate or to improve the health of Nigerians. All levels of government will need to play their part, and Nigerians themselves will need to play their part. Yesterday at the UHC Day, very early in the morning, the Federal Minister of Health had a walk to demonstrate that individuals can also take action in terms of producing health by doing the behaviors that are necessary to prevent them from getting on the path to getting chronic diseases. So there are many facets of action that Nigeria as a collective will need to take for the health of the population of Nigeria to improve, not only the health of specific individuals.
And we hope that Nigerians, that there will be increased campaign in that regard, and maybe policies that would also encourage firms and companies to be able to take action.
Even when constructing roads, build walkways.
Ensure
that people
those kinds of
find
things
it easy.
And also people shouldn't drive on walkways.
Yeah.
There'll be so much. So much to do in that particular area. But I know that this is not the first time that we've tried something. You talked about the Health Act being signed in 2014. In 2015, when Professor Isaac Adewale was the Minister of Health, one of the things he did say then was that they were trying to go back to the roots, which was, go back to primary health care. The plan then was to build 1,000 primary health care centers. I think they wanted or even, I think, 774, but they were looking at 1,000 eventually. And the federal government was even willing to intervene at that primary level. I don't know how far they got on the agenda, but this is not the first time we're seeing a system involving state governments. Why are you optimistic that it will work this time around?
I think some fundamentals have changed. The political will is there, much, in my view, in an unprecedented way. And you heard the Director General of the World Health Organization commending Mr. President for this ambitious agenda. First, the political will. And you saw the Nigeria Governors Forum and all the governors that showed up to really support that. So that is the starting point. Secondly, we're not building new primary health care centers alone. There are existing primary health care that are dysfunctional, don't have roofs, don't have furniture. Those are very practical things that can be done, and those have been assessed. An assessment of all the primary health care facilities in Nigeria. That is a basis, and there is resource allocated. If you talk about doing anything and you don't allocate the resources to it, that's almost like fiction. But in this instance, there is a deliberate plan and there is resources. There are resources being allocated towards that. And additional ones that we have raised for our development partners who also spoke about it yesterday, that we would make use of to translate these ideas into action, and then a mechanism to track that progress, so that a year from now, when we have the first joint annual health review, we may not get to all the facilities that we want to get in the next 4 years, but we will start to move in that direction. We can be able to tell you how many frontline health workers have been trained over time. And that will be visible, and we committed in the compact that we will make it visible. That coordination across all levels and that transparency, that accountability has been a key missing part of the conversation around improving health. We're trying to fix that, and that compact is a first major step. It has never been done, where federal government and states had a broad-based compact signed alongside the development partners to move in one direction, in a sector-wide way, as opposed to various activities, each one doing his or her own corner in the sector. So it's a very coordinated direction to push everyone in the direction of investing in the front lines, investing in the things that will make the health of Nigerians better, so that the experience of Nigerians with the health system will improve. It requires also the population, the citizen engagement as a component of that. The civil society were there. We have had People's Voices survey. We visited the facility to see for ourselves how they are. That is very key, that the Nigerian people are also party to the production of health. Because you cannot just produce health in a health facility. The population themselves have to behave, to accept vaccines. Talk about vaccines, diphtheria. Folks have children that have diphtheria. 98% of those who have diphtheria had not been vaccinated. So those are the things that even when you provide, Nigerian population has to buy into it, and we work together to produce health.
Prof, pardon me to just jump in on that note. Vaccine hesitancy. This came across in passing, though. I didn't pay too much attention because that wasn't what I was looking for at the time. There was this material circulating about cervical cancer vaccines in this country, that people shouldn't go for it or something.
That's the HPV.
Yeah, have you heard about that? What's going on with that?
No, this myth gets circulated by conspiracy theories. They are baseless. This is not the first country. Several developing countries have had this vaccine for years. This is a vaccine that has been developed, has been tested, it's safe, it's effective, and there isn't enough of it, and it costs resources. Federal government raised the resources, put the mechanism in place, and said, look, bring your wards to protect them against the future threat of cervical cancer. We've got 8,000 women every year who lose their lives from this disease that is now preventable. So it only takes a parent or a leader who does not understand the value of this to say, look, I will rather expose my daughter to the risk of having cervical cancer later in her life. So that misunderstanding is there, and we've tried to address it. And to be fair, Nigerians did not follow those lone voices. We had a very successful first phase launch of the cervical cancer vaccine. 78% coverage in the states that participated in it. And the second phase will be in the next, in the first quarter of 2024. So Nigerians did not heed these lone voices on the side. And these are conspiracy theorists who oftentimes I would say based on pseudoscience, because the science is very clear. This is safe, this is effective. And it's been done in countries in Africa, countries in the Middle East, countries in Western countries, and everywhere.
Part of the controversy we've also seen, sorry to interrupt you, will be what ages of women, because oftentimes some people say it was just for girls. Oh, the teenagers is still okay. By the time you're an adult, it's no longer effective. Can you tell us clearly what ages should be accepting the HPV?
9 to 14 is the best age to get that, because the HPV transmission begins to rise beyond that age. So you need to protect. This is a virus that is slow in the changes that it causes in the cervix, and that it takes years for the cancer to start to develop and to manifest itself. So you have to do it at the time when the protection that the vaccine offers would be useful, rather than wait on it. It's late when already the virus had infected the young person and has begun to initiate the changes against cervical cancer. That is based on very strong scientific evidence, and that's why it's done.
9 to 14, you say?
Yes.
Okay. I'm sure that you're also aware of the many challenges that currently face the health sector, and each day we're inundated by the news. Just yesterday was MD Khan that was letting us know how many consultants were leaving our country almost on a yearly basis. I mean, about 1,000 consultants, we understand, have left over.
NRD, as of July, said 9,000.
Wow. So MD Khan is speaking of NARD. Thankfully, they haven't gone on any strike in recent times. Also have their own issues as well. And right now, we know that their members are also suffering. If you speak to the nurses, they also have their own. And almost every sector, or almost every specialty within the healthcare range or the healthcare line, if you speak to them, you will suddenly hear tales of war and how a lot of Nigerians are leaving the country for greener pastures. This must be something of concern to you. When you talk about retraining 120,000 people, I'm wondering, are there still 120,000 of them left? How are you looking every time you see these headlines? How do you respond to them?
So that's precisely the point. I think you need to frame the conversation around those who are staying. There are many more health workers that are staying, serving in this country, sometimes in not easy circumstances, sometimes facing challenges in their states, in their villages, in rural areas, but they are still working hard to serve our population. They get ignored. The focus, unfortunately, becomes on those who are choosing to leave. So we appreciate those who are working very hard to serve our population, because at the end of the day, it is Nigerians that will fix this health care system and this country. That is what the president, I think even yesterday, alluded to, that we need to appreciate them, we need to invest in them, we need to make life easier, we need to improve their welfare, we need to have the infrastructure, diagnostics, and all of that. For those who are choosing to leave for whatever reason they are leaving, I think what we are going to be doing is to expand the training so that we produce more. In the event that some leave, some will stay. And for those recipient countries that are actually taking some of this, they are taking where they did not sow, in the sense that Nigeria has invested in high quality education, training these young people to university, almost debt-free in many instances. And when they are just ready to serve the country, they walk out to go to countries that did not invest in their training. So what we are asking is those countries get in line, and if you take 7,000, invest in producing 7,000 doctors.
Does it work like that? Does it work like that?
Well, that's what we're asking. In response, I mean, just look at it. Morally, is it defensible that you take what you did not produce?
I thought the doctor just wanted to look for greener pastures.
Well, but the doctors did not train themselves.
Oh, but didn't they pay their school fees themselves? Is it the ones that went on scholarship or what?
Well, the doctors get trained.
Yeah.
But for the recipient countries that are getting this label, they are taking from what they did not sow. And why are we asking for them to expand the training? Because it makes sense. You brought the issue of thousands that are leaving. And they leave for various reasons. Some legitimate, some for greener pastures, and there are so many reasons, family reasons, to advance themselves. And some will definitely come back. But as countries recruit them, And there are some countries that come into Nigeria, come to African countries and recruit health workers actively. What we are asking is, it just makes sense to invest also in the pre-service training. None of those countries are investing in the pre-service training. Can you at least expand the training of those? Can you help train more so that as people choose to leave, we're also being replenished? But if you're taking only and you're depleting, you're constraining the health sector even further, is that the outcome that we want?
So what's the response of these countries? Have they responded to us?
Well, we've seen in other countries compacts being signed between the recipient countries and those countries.
Okay.
In Ekiti, 4 weeks ago, we did pass a resolution as a Council on Health to engage with the bilateral partners to see how they can begin to expand the pre-service training. Yesterday, as part of this compact that was signed, it was raised. So we're moving forward to discuss with some of the recipient countries the prospect for them engaging with us in expanding the pre-service training of medical workers.
How many countries have we spoken to about this?
Well, there are many countries that take our physicians. I think there are those that go to the UK and to the United States. What we've passed as a policy is that we'll engage with them so that we draw the collaboration with them to expand the pre-service training in our country. That is where we're going.
All right, there's health insurance, there's fake drugs, there's so many, but my colleagues in Lagos have got questions for you too, Prof. Go ahead, Jen.
Yes, thank you, Chamberlain. Good morning, Professor Pate. Perhaps, what would make them stay, following on the strength of Malkwe's question, would be the national budget, and that's been at the heart of the conversation for medical practitioners, both at home and on the international scene. You said earlier that states should come up in terms of what they commit to the health sector. But I wonder if the federal government is leading by example in that regard, when you consider that in the latest budget that has been presented by the administration, it's just about 5% that has been devoted to the health sector. If you consider neighboring Ghana is doing 6%, they are moving closer to the Abuja Declaration. Even Rwanda, which is the template for development in Africa now, has 7% committed to its national budget in the last check, at least in 2020. So in 2023, it should have gone up. Why is it increasingly difficult for Nigeria to up its commitment to the health sector amid so many competing needs in that sector?
Yes, I think you mentioned 5%. You should note that it's from 3.68% to 5%. That's already an increment in 1 year. And I think that's commendable on the part of the President and the federal government to increase health allocation. And we'll need to use those resources. And where we're channeling those resources, including the infrastructure, upgrades of our teaching hospitals, of our primary healthcare centers, equipping them, cancer equipment, for instance, many of the elements that are necessary to improve the working environment for the health workers. So you should see in the year to come, this first really key budget of Renewed Hope, that the infrastructure and equipping of the facilities would be improved. And that's a start. We hope that over time that will be sustained, but the states can also complement the federal government in expanding also their budgetary allocation. Overall, as a country, are we spending enough? We are not. I think there is a lot more that is being spent out of pocket by Nigerians. And the public component of it, it's really below what it should be, as you said, compared to other comparator countries. But there's a start. There's a start, and we have made that start with this increase from 3.68% to 5% of the federal government allocation. And if that is sustained, and if we use those resources and begin to produce the results, I believe that we should see sustaining of that direction that has been set by our government.
Talking about sustained direction, there's 774 billion naira here for personnel costs for the year 2024. What's the guarantee, Honorable Minister, that this will cover the concerns of the National Association of Resident Doctors that went on strike many times in the preceding year over non-payment of their medical residency training fund, the consolidated medical salary structure, skipping arrears, the demand for training, such that the congestion or the lack of personnel within the health institutions can be addressed. So what's the guarantee that this amount will address these concerns such that we can have stability in the federal government health institutions in the coming year?
Yes, I think you will notice that in the last 6 months of this administration, we have had stability in terms of the rancor that used to affect this sector. The strikes have become much less frequent, and in fact, various health professional associations, unions have been very responsible, trying to work with this administration to bring up issues that have been outstanding for many years and to get them addressed over time, and not take strikes as the first mode of almost coercing government, but rather to take a constructive view that let's put the Nigerian people at the center of our attention, and all the differences that exist across professional groups or between professional groups and governments and commitment that have been done but unmet, let's address them in a responsible manner over time. And I think that is a direction that we are going, so that the sector becomes more stable, that we serve the clients of the sector, and the professionals increasingly get what is due for them, and that they get treated with the respect and the appreciation which we have for their work. It's only fair that those who are working in very difficult circumstances, the health workers that are out there, they are appreciated as well. And we are doing that, and we're engaging with them. In fact, even later today, I will be meeting with 3 of those associations. And we are in constant dialogue to see how we can make things better. It's not easy because there are, I will say, several years, at least 10 years of promises, negotiations that have happened over time, and all kinds of issues that have been outstanding. So, but it will not be something that we can just say resolve in 1 month or 2 months, but in the last few months, I think we've had a very constructive set of engagements with various groups, whether it's the Medical Association, the resident doctors. And for instance, you mentioned the National Association of Resident Doctors in particular. They had a strike earlier in June, July. And usually there is this policy that was existing of no work, no pay. This president, in his wisdom, gave an exceptional waiver that, in fact, allowed the government to look behind what it could have extracted from them, in the spirit that we will work constructively going forward to avoid situations whereby strikes become the norm, where lives are lost. These are Nigerian lives that we are also trying to protect, and we shouldn't use Nigerian lives as a bargaining chip. And I think professional groups, whether they are doctors, whether they are nurses, whether they are pharmacists, I think understand that.
Well, Professor Pate,
for the health sector, the unionism that we practice would be different, or should be different.
Pardon me if I may come in there. I'm just trying to seek clarity. Are you saying that the engagement you're having with these associations means that you are going to meet these concerns over time, not in the immediate, in the immediate time? Are you saying that you're meeting them over time? Are you saying that there is no guarantee that you are going to implement increase in salaries in the short term rather than long term?
I think for what is within the control of the health sector, those elements, we're engaging them in a constructive manner, and we would be addressing those constraints over time. And I do believe that they understand as well. And so far, it's been a very, very healthy dialogue that we have maintained. And I've mentioned to you the specific instance where, in fact, there's been reciprocity, for instance, with regards to the resident doctors. So we will continue in that direction. At the end of the day, the fractious relationship between government and unions is not healthy for anyone, not for the health workers, not for government, not for Nigerian citizens. So we all have to rally around and say, okay, what is it that is feasible, and what can we agree on? And if we don't agree on certain aspects, also be sure that we put them clearly so that there is no let's say, promises that are met but not kept, because these are things that have been there for many, many years in a way.
I ask because remuneration is at the heart of some of the issues, that caused this mass exodus of medical personnel from the country to other countries in search of greener pastures. And I wonder if the administration is in full realization of this and will act to, implement better working conditions in the form of remuneration and other allowances. I wonder if you answered Marquet's question earlier on about whether we really do have 120,000 medical workers that you say the administration plans to retrain in the short term. Because at the last check of the Nigerian Association of Resident Doctors, they say that Nigeria has about 40,000 medical workers. I hope that I got that figure correctly, but I know that it is far below the 120,000 that you're proposing to train. So can you clarify where you are bringing that figure from, 120,000?
Yes, no, I will. And in fact, I'll share with Channels TV the distribution of the health workforce in Nigeria. We have got about 800,000 health labor force in this country. Much of those health workforce are in the public sector. About 25% or so is in the private sector. The frontline workers, we've got about 70,000 community health workers, about 50,000. I'm giving you an estimate in my mind of nurses, midwives. We've got pharmacists, doctors that are in Nigeria, are working in various parts of our country, sometimes in very difficult circumstances. So in the context of remuneration, you should understand that health workers are a very special breed. Whoever goes into healthcare profession has an intrinsic motivation to help others. So it's not driven by just monetary incentives alone. That many folks go into the healthcare industry, that you make tons of money, but those who are willing to serve others, to save lives, to reduce pain, are a special breed. And yes, the remuneration, I think, is a key component of that, making it regular, making them have living wage, yes, but that's not the primary reason that people will just pack their things and go.
Right. So if you insist that we have 120,000 health workers across the country, public, private, are they enough? If they aren't, what figure are we targeting?
I'm sorry, sir. I think you did not understand what I was saying. We have much more than that in terms of the healthcare workforce.
Right.
The frontline health workers is what I'm referring to. That are existing. The more than 60,000 community health workers of different cadres, the nurses and midwives. I think if you just step out into primary healthcare centers in some of the areas that you'll see them. I've seen them. There are many of them. They are registered with the various regulatory bodies. You can also ask the MDCN or the Nursing and Midwifery Council of Nigeria. Those numbers are there, and I will provide the chart that describes the health workforce for you to have a better understanding of what we have. And the focus of the conversation, while it's not to be ignored that some are leaving, we should also appreciate those that are staying. Because there are some that are staying and working very hard in sometimes very difficult circumstances, facing all kinds of challenges that all Nigerians are facing right now.
Right.
And these challenges that we're facing are not going to be with us forever. I think going forward, we do see, in fact, there can be light at the end of the tunnel if we can work towards solving the immediate challenges that we're facing as a people.
Well, Honorable Minister, so my question is still that, now you say we even have way more than 120,000. As it stands right now, I know we're trying to look at the cup half full, which is very important. We need to, of course, salvage what we have left and ensure we make the most of it. So do we have enough health workers in Nigeria? That's my question. So if we don't have enough, what is our target?
Yes. So that's a better question now.
Well, that was what I asked earlier.
Enough, we don't have enough. No, you referred to 120,000 as if it were the totality of the health workforce that we had, which I think you did not understand. But we don't have enough. And in fact, by 2030, we have a deficit relative to the standard that we should have, and that we need to produce more. And that's why, but 4 weeks ago, we doubled the quotas for our schools of nursing and midwifery to double their quotas, to double their intake. But as we expand that, there needs to be also the investment in terms of the infrastructure, the training materials, so that we are not trading quantity for quality. We also need to maintain quality. The reason why our health workers found attractive by others is because we've got good quality training programs to start with. And that's something that we need to maintain so that we don't produce health workers that are not at the quality that is necessary to provide the best healthcare service. So we're expanding that. And that is part of the effort that government has already moved in that direction. And we're calling on others to invest in the pre-service training of health workers so that we can replenish the pool. Globally,
I hope
this is not a Nigerian issue alone. Globally, let me just finish. Globally, there is almost an 18 million health worker shortage in the world. So it's a global phenomenon because many of the Western countries are aging and require health workers to help serve their needs, and therefore are extracting the health workforce from many countries, not only Nigeria. So health worker migration is not just a Nigeria phenomenon, it's also a global phenomenon. And we're trying to deal with it in our own context, just as other countries are also dealing it in their own context. I think we should put it in the proper context.
I think at the end of the day, the goal is to work together to ensure we have better healthcare in Nigeria, because it's what we'll use anyway, wherever you are. I know that the target, or at least a promise was given as far back as July, that the funding for health will be 10% of the budget. What we have now is, what, 5%? Or thereabouts, which is still a long shot. And that was from the presidency itself, saying there will be 10% funding, and it was categorically said. I mean, we've had situations in Luth, for example, where you have auxiliary staff saying they earn 30,000 naira, they've sought increment, nothing is coming. There was that report as well that some wards were collapsed. Well, majorly, the management said it was for renovation, but it still alluded to the fact that this, I would say, Japa syndrome is also responsible for it. When the president said yesterday that doctors, even health workers abroad, should please come home, the question then is, what will be in it for them? And I hope you can use this opportunity to speak to them right now. What's in it for them? I mean, I've had conversations with a lot of them who say they don't mind coming to share their expertise. Home is always home, whether you like it or not. But what's in it for them in terms of the funding? They said that 10% of the population is responsible for 60% of the funding of health sector. So questions about health insurance, how equitable is it, universal health coverage, even the policies. If you were to speak to these health workers abroad that the president is asking to come home, what would you tell them is in it for them?
I will just quote for them what the former US President John F. Kennedy stated. Ask not what your country can do for you, ask what you can do for your country. And I think if they can answer that, they will find the right answers in themselves. Because wherever they go, they serve other populations. And there are many reasons why they will choose to do that, but whether part-time, whether on medical missions, and there are many health workers in the diaspora who are already expressing interest, and some are coming back and serving here, setting up private practice, doing medical missions, and we appreciate them. The Association of Nigerian Physicians in America, which I was, when it was founded, I was also doing my training, and there are many others in the United Kingdom who are always looking for where they can contribute. As opportunities become available, whether in the public sector, whether in the private sector, they cannot earn what they're earning in the United States. You cannot earn $1 million a year in Nigeria in the government service. You may earn that in the United Kingdom or the United States. But there is something beyond money as a motivator for serving your population. And as you ask me to say what they should be thinking about, let them ask not what Nigeria can do for them, but what they can do for Nigeria, because this is the country that they have. Wherever you are a Nigerian. Whether you're in Australia or Europe, they will always look at you as a Nigerian, as an African.
All right, I think that quote will work for politicians as well, Prof. They should ask not what money can. It's not just about money. They should also try and do a lot to serve the people properly. But unfortunately, we can't touch on health insurance, the conduct of health workers to Nigerians, manufacturing concerns here, which are issues I imagine that the ministry will be thinking about addressing as well, especially since, you know, there's an MOU And I know that at the end of the day, I know you'll be optimistic that your own mark will be higher than several others having signed this, but everybody looks forward to a good healthcare system, actually. So we have to thank you for coming on, Professor Ali Pate, Coordinating Minister of Health and Social Welfare. Did we touch on the social welfare bit?
I already underlined that. Well, I guess we'll have to have another conversation with you very soon.
Because when we hear social welfare, it's a different mindset for social welfare.
Really, I think the President spoke about it repeatedly.
Okay.
It's a government philosophy to improve the social welfare of Nigerians. And it's not necessarily only what the Ministry of Health does. There are other facets of the administration that are dealing with the intersection of the well-being of Nigerians, whether it's the Ministry of Humanitarian and Poverty Alleviation, whether it's Women Affairs, whether it's the youth, whether it's education, whether it's police, with the affairs of the welfare of the police force and the defense. So it's the welfare of Nigerians overall. It's almost a philosophy of governance.
How do you intend to measure that?
Well, I think if this administration 2 to 3 years and see what the president is able to do in terms of the agenda he's laid out, I think Nigerians will experience that. Because probably the best answer will be the experience of Nigerians over time.
Because a lot of people are expecting so much from the health, from almost everywhere, because that's why they were elected in the first place. So thank you for coming on, Prof, and all the best to you and your team.
Thank you very much. Thank you.
All right. We're back in a moment. Don't go away.